Fraudsters are cheating the NHS out of billions of pounds every year, according to a new report by the accountancy consultancy PFK and Portsmouth University. They say patients and NHS staff, including GPs and dentists, are ripping off the health service by as much as £5.7 billion a year, which is 5% of the annual budget. The Department of Health has criticised the report, calling it highly speculative. The numbers in the report, though, are staggering. GPs are accused of £348 million of fraud every year, according to the report's authors, even creating so-called ghost patients to charge the NHS for treating people who don't exist. Dentists could be defrauding the NHS by up to £137 million annually. And patients are apparently claiming £304 million worth of free prescriptions, eye tests and dental work, which they're not entitled to. Well, with me in the studio now, we're going to be talking more about the case of one whistleblower who was caught up in a case, Sharmila Chowdhury. Sharmila, welcome. You were concerned about what you believe to be going on in your hospital. Tell us why you decided to blow the whistle.
Basically, I was the budget holder and I was responsible for the attendance of all staff, and I noticed that my consultants were moonlighting and they weren't there in the department when they were supposed to, and it transpired that they were doing this every week. So basically the patients weren't getting the treatment that they should do, plus NHS was wasting money on consultants who weren't there. So they were actually going to a private hospital being paid for the work that NHS was also paying.
Now, no case was ever brought against these consultants,
No.
But you felt you wanted to draw attention to something that you believed to be an issue.
Yes.
Why did you feel so strongly about it?
Well, first of all, this is public money, which was being wasted. This money should have been spent on patient care, and it was vast sum of money. Also, I was the budget holder, so it was my responsibility to report it. If I signed their attendance record to say they were there and they weren't, I myself would be committing fraud. So it was important.
So when you raised your concerns, what happened?
It got escalated up the management chain. Everyone agreed there was a problem, but nobody would tackle it. Eventually, months later, well, 2-3 months later, a false counter-allegation was made against me, and no one even checked to see if it was accurate or there was any evidence. They marched me out of the premises. They escorted me out of the building, in front of all my staff. I managed 60 staff in the department. I was suspended, dismissed, even though there was no evidence against me. I finally took the case to interim court hearing, and I won that. The court found that I had been dismissed unfairly, and it was a direct result of whistleblowing. The trust refused to have me back. I then did an appeal procedure, which I also won, but at this stage the trust said the post was no longer there, so they said it was redundant. So in the end, I was offered redundancy, which was 2 years' pay. Out of that, I had to pay legal fees. My legal fees had escalated to £130,000. Out of that, I had to pay about £78,500 for my settlement, which was only 2 years' pay, so I was not left with very much. I couldn't get another job. I was offered a job, and then as soon as they found I was a whistleblower, they withdrew the post. I've had interviews cancelled. I now have breast and lung cancer, which numerous consultants think is because of direct result of whistleblowing, the stress of it. I may actually lose my home because no income. In fact, although I am working on a temporary basis, the work actually runs out in 6 weeks, and it's not the payment that I was receiving, it's not even the job that I was doing, so my whole career has been destroyed. So I am actually looking at losing my home in very near future with cancer.
Do you wish you had just kept quiet?
No, not once. I may have done things differently. I should have probably looked for another job before but you do what you think is right at the time, and you have to do what's right at the time. I don't regret ever blowing the whistle. You have a duty. Once you work in the NHS, you have a duty of care, and you have to abide by that. But the system has failed really in protecting me as a whistleblower, as well as not investigating any of my concerns.
The message from the government and elsewhere within the NHS is that whistleblowers absolutely should come forward. It's the right thing to do.
They should come forward, but then on the back of it, they should also be protected. During my case, it's 6 years now, I have been in touch with the Treasury. George Osborne knew about it, Jeremy Hunt knew about it, David Cameron knew about it, Simon Stevens knew about it, David Pryor. So all the senior people, some of whom I've actually met as a one-to-one basis, Sir Robert Francis, as part of the whistleblowing review, knew about it. So they all knew about my case. So none of them have intervened to look at my concerns and intervene or investigate, even though I had all the evidence. No one had intervened to actually protect me as a whistleblower, and I'm now left with my career demolished. I may actually lose my home. My health is not in a good place. So
how important is it within the NHS that people come forward to raise concerns where they have them? We've got these figures today on the apparent scale of fraud within the NHS.
Yeah.
How easy is it potentially for fraud to be covered up if it's not called up by
very easy to be
whistleblowers?
covered up, because all that happens is no one takes action. There is no accountability in the NHS. And unless there is accountability of individuals and senior managers, nothing will change. And currently there is no accountability. Even when it's gone to a higher authority within the NHS, nothing has happened. So unless that changes and there's accountability, and there needs to be an effective independent body who investigate these concerns. There also needs to be an independent body who protect whistleblowers. Whistleblowers should not be left financially in a destitute position where they're homeless, jobless, because they've actually done what was right. And these are the very people the NHS should be fighting to keep and supporting them, and it's not happening. And unfortunately, as these cases appear, it actually raises alarm bells to other whistleblowers not to raise concerns. So even though you say you've got duty of care to staff, they only look at not very far and they see what happens, because not only do the concerns themselves don't get looked into, you yourself destroy your whole livelihood, your career, your health. You lose everything.
Sharmila Chowdhury, thank you very much for coming in and
You're
telling
welcome.
us your story. Get in touch if you've got thoughts on this. 61124, the number for your texts.